All right, let's dive right in. If you're prepping for your medical school interviews, you know the MMI ethics station can feel like the final boss battle, right? But here's the good news. We're going to break down exactly how you can flip that challenge into your moment to absolutely shine. Let's kick things off with a classic. Okay, so picture this. You're the junior doctor on the team. The ward round's about to kick off. A nurse quietly pulls you aside and says, "I think the consultant is drunk." Whoa. Your heart starts pounding. What on earth do you do? This is exactly the kind of high-stakes scenario they throw at you to see how you handle the pressure. But listen, here's the secret, and I really want you to take a deep breath and let this sink in. Your interviewers are not looking for one single perfect answer. Because honestly, there often isn't one. What they really care about is your thought process. They want to see how you reason your way through a messy situation with logic, compassion, and professionalism. So you see, the MMI ethics station isn't so much a test as it is an opportunity. It's your shot to show them the kind of moral reasoning and core values that you'll bring as a future doctor. And we are going to give you the strategy to do exactly that. Now, before you can build a strong argument, you need the right tools in your belt. And in the world of medical ethics, that means getting to know the 4 fundamental pillars. Think of these as the rock-solid foundation for every single ethical decision you're going to face in your career. First up is autonomy. This one is huge. It's all about respecting a patient's right to call the shots for their own body and their own care. If a competent adult wants to refuse treatment, even life-saving treatment, that's their right. Our job is to give them the information to make an informed choice, not to make it for them. Next, we have beneficence. You can think of this as the do-good principle. It's pretty simple in theory. You should always act in the patient's best interest. You're always asking yourself, what can I do that will help this person the most? It's really the heart of why we go into medicine. And right alongside doing good, we have its partner, non-maleficence. You've probably heard the famous phrase, first, do no harm. That's this pillar in a nutshell. It's a constant reminder to weigh the risks. Sometimes the best course of action is to avoid a treatment that might cause more harm than good. And finally, we've got justice. This one is all about fairness. How do we decide who gets a single donor organ when there are multiple patients who need it? Justice tells us we have to use fair, unbiased criteria and make sure every single patient is treated equitably. So, you've got your toolkit with the 4 pillars. Awesome. But how do you actually use it when you're under pressure and the clock is ticking? Well, you need a plan. So let's walk through a simple 5-step framework that will be your battle plan for any ethical scenario they throw at you. This structure is your key to a great answer. First, you get the problem, maybe even ask a clarifying question. Second, and this is so important, you always look at both sides of the argument. Third, you bring in those 4 pillars we just talked about. Fourth, you make a decision and you explain why you made it. And through it all, step 5, you show empathy. You show you're a human being who cares. Okay, theory is one thing, but let's see how this all works in the real world. We're going to take our toolkit and that 5-step plan and apply them to a couple of the most common types of MMI scenarios you're likely to see. You'll often see 2 main themes pop up. First, you've got the difficult colleague scenario. That's our drunk consultant. It's a test of your professionalism. The second big one is a clash over patient autonomy, where a patient's choice goes against medical advice. The great thing is, our framework can handle both perfectly. Let's go back to our drunk consultant. For this kind of problem, there's a fantastic little tool called the SPIES framework. S is for seek information. Don't just assume the nurse is right. P is for patient safety. That is your #1 non-negotiable priority. I is for initiative. You can't just stand there. You have to do something. E is for escalate. Tell a registrar or another consultant immediately. And finally, S is for support. Your colleague is clearly in crisis, and you need to think about their well-being too. This framework gives you a perfect structured answer every time. All right, we're in the home stretch. Let's wrap this up with a final rapid-fire briefing. The absolute must-know do's and don'ts for interview day. So, let's break it down. Do show them you can see the gray areas. Do use those fancy ethical terms like autonomy and beneficence to show you know your stuff. And do back up every single point with your reasoning. Now, for the don'ts. Don't jump to a conclusion in the first 10 seconds. Don't forget that there's a real person at the center of this problem. And please, whatever you do, don't bluff. It is so much better to say you'd ask for help than to just make something up. You know, these interview questions, they're not just abstract puzzles. They are a reflection of the very real pressures of being a doctor. And it's so important for you to know that as you start this journey. You are never alone. The medical profession has real systems in place to support its people. For instance, the BMA has a confidential 24/7 support line. The Doctors Support Network offers peer support for mental health, and for a situation just like our scenario, the Sick Doctors Trust is there to help with substance use concerns. Always remember, reaching out for support isn't weakness, it's a sign of incredible strength. When it comes down to it, the MMI Ethics Station is really just your first chance to sharpen what will become your most important clinical tool, your ethical compass. This isn't just about passing one more test. It's about deciding, right now, the kind of doctor you're going to be. So the real question is, how will you use yours?